students, today we will be learning about applied aspects or the clinical terminologies related to the abdomen or the umbilical region. Umbilical region. So, what is the umbilical region? The umbilical region is the middle region among the 9 abdominal regions. So, we can imagine this as the center portion of the abdomen. Now, the first terminology is the raspberry red tumor or the cherry red tumor. So, what do we mean by raspberry red tumor or the cherry red tumor? So, it is the tumor which occurs due to remnant of the vitello-intestinal duct. Remnant or part of the vitello-intestinal duct. The vitello-intestinal duct is supposed to be present only in the intestinal duct. So, the vitello-intestinal duct is supposed to be present only in the umbilical condition or umbilical phase. But if there is the remnant or the part of vitello-intestinal duct remaining, then it is called as the raspberry or cherry red tumor, as it gives tumor in the umbilical region. Now, related to this condition is the another clinical condition called as the fecal fistula. So, the fecal fistula is also the abnormality of the vitello-intestinal duct, but here the entire vitello-intestinal duct is present. Entire vitello-intestinal duct is present. So previously there was only the part of the vitello-intestinal duct, but now in fecal fistula we have the entire vitello-intestinal duct that is present. Now, following the same physiology, that is remnant of the embryological structures, we have the urachus. So, if there is the presence of the some part or the remnant or some part of the urachus, then it is called as the cyst. It is called as the cyst, urachal cyst. But if there is the entire urachus that is present, then we will call it as the urinary fistula. Urinary fistula. Now we will be learning about the fifth terminology, that is omphalocele or exomphalos. So, omphalocele or exomphalos, also known as the umbilical hernia. So, during the 6th to 10th week, during the 6th to 6th to 10th week, the bowel must return to the body cavity. So, herniation of the abdominal viscera due to failure of the bowel to return to the body cavity from the physiological herniation. So, what it is basically trying to say is that during the 6th to 10th week, the bowel tends to come or comes inside the body cavity. But if it does not occur then a condition arises which is omphalosil. So in this condition, there is the inflammation of the umbilical ring and the abdominal viscera is also herniated. Now we'll come to gastrosis. Gastrosis. So it is the protrusion or coming out. Protrusion or coming out of the parts of the abdominal contents. Coming out of the abdominal contents. Abdominal contents directly into the amniotic cavity. Amniotic cavity. So the abdominal contents come to the abdominal amniotic cavity. Due to the abnormal closure of the body wall connecting around the connecting static. So here the viscera is not covered by the peritoneum, but comparatively it is more safer than the omphalosil as the survival rates are more. Now it is not associated with chromosomal abnormality similar to the exomphophallus. Thank you.